how do you, as a person in this space, doing what you do, figure out who to trust or who to listen to?
That's a good question. I think that it helps for me because I've worked with so many functional medicine
Mhm.
practitioners that I understand like the character, I understand the reasons for why they would
Mhm.
say things or financial ties that could influence a person's recommendations or just their own indoctrination, their own inability to see outside of what they were taught in a textbook and not be able to apply it to a clinical space. Like one example would be in 2014, we started the Cleveland Clinic Center for Functional Medicine, which was the first functional medicine hospital in the world. That was under Dr. Mark Hyman, and I started the nutrition department under him. And we were completely labeled to be this quacky department. We started in the basement of the Cleveland Clinic, and we had 2,000 people on the wait list within a month. And I'm living with my best friend that was in medical school at the time and was with all of these physicians in the other departments. And she'd come home and tell me, oh, we just send all the crazy people to functional medicine because you guys just handle all the crazy people. Even though I would come home with stories about like, this person, we reversed their PCOS today. This person came in and, doesn't have to take their antidepressants. Crazy stories that, in my early career coming home with that it was like, well, this is what I've been indoctrinated to believe that if you believe outside of this box that
Mm.
we were taught in, then you're crazy. There's a balance of people who really do follow unbiased science and then apply functional medicine principles. And I think that some people on the spectrum skew so much into follow the science that they lack common sense to say, well, if we're following the science, then why are our health outcomes so deplorable? And then on the other side, the wellness influencers who don't necessarily understand the in-depth level of the science and then make claims because companies are telling them to or because they saw it on TikTok that also can be dangerous in a person's credentials, but then not only caring about their credentials, looking at their experience, how many years they've been doing this, what level of clinical experience they have, because I will say that working with more people helps you better understand what works and what doesn't.